Good evening, ladies and gentlemen. Welcome to yet another interesting topic. In fact, a topic that has led to us, will I say, this is part two of this particular topic. We're talking today about H. pylori and peptic ulcer disease mostly. Of course, we're talking about peptic ulcer disease, but we're going to focus on H. pylori. A lot of things people say, people are not sure of. Let us find out whether these things are possible. Is it even possible to treat H. pylori? I know people that have had H. pylori, peptic ulcer disease caused by H. pylori for 10 years, 9 years. In fact, sometimes some people just believe that they can even just live with it. They're tired. So they just, okay, just live and let live. H. pylori. They stay in your own section. Let me just stay in mine. But unfortunately, we all know that that is a very terrible decision. I remain my humble self, Lucky, Dr. Drugs. And tonight, I have the pleasure of presenting this amazing topic. That's me, Dr. Drugs. And our table of contents goes thus. We can't talk about peptic ulcer and H. pylori without looking at the human stomach a little, then at least. Then we have to also define what peptic ulcer disease is. Let's talk about its types briefly, signs and symptoms, causes and risk factors, complications, all the way down to is peptic ulcer disease treatable? That's what then we'll now find out from there. So as we all know, the human stomach is a hollow muscular organ in the digestive tract that helps to break down food after chewing and swallowing by means of what? Enzymes, because these enzymes increase speed of breakdown and hydrochloric acid and churning action. Churning action is the mechanical action or activity of the stomach, which is used to grind and blend the food in the stomach. Now, the wall of the stomach is protected by a lining. Let's just call this lining let's call it a nylon, okay? And let's assume that that nylon prevents the acid that is secreted by the stomach from digesting itself. In fact, this nylon or this coating that protects the stomach from itself is called the gastric mucosa, okay? Now, peptic ulcer disease, as we already talked about in the last video on peptic ulcer disease, is simply a sore or break in the inner lining, or let me say that nylon coating, let's do it that way, that protects the stomach from its own acid of the stomach, the beginning of the small intestine, or the lower part of the esophagus. That is also found in these areas as well. Now, the mucosa, if you look at the left side of your screen, is a moist tissue covered by protective mucous layer that lines the gastrointestinal wall, and they serve as a barrier that helps protect it from its own digestive enzyme. We'll find out why shortly. Now, one of the types of peptic ulcer disease we have gastric ulcer. That's the one that happens in the stomach. We have the duodenal ulcer. That's the one that happens just after the stomach, as you can see here. Then we have the esophageal ulcer. That's the one that happens at the end of the esophageal, just the junction between the esophagus and the stomach, as you can see up there. And you can also see the gastric ulcer where it usually happens. And that's but these sores can occur as a result of damage by what? Helicobacter pylori bacteria. And the effect stomach acid on affected areas have, as well as excess acid secretion, as in cases of gastroesophageal reflux disease, that's GERD. You can see gastric ulcer. If you look at this image very closely, you find out that this stomach is wondering what Helicobacter pylori is doing there. I don't know whether it's having a bubble bath or it's watching a football match right there in the stomach. And you can see the holes it's drilling in the stomach wall. And obviously, this stomach is not comfortable with it. And of course, it's often caused by Helicobacter pylori infection, as you can see in the depiction here. Also, but what are the signs and symptoms? The most common sign is pain. Stomach pain is often the first sign of peptic ulcer disease. It occurs after eating in gastric ulcers and before eating in duodenal ulcer. You see the repercussions shortly. That's why you find out that some people that have gastric ulcers, they slim down. You find out why. Then people that have duodenal ulcers add weight. You find out why as well. It may also be like a burning sensation or sharp pain, as we know that radiates medially around the stomach region. Sometimes that is felt even all the way down to the back. Now, stomach discomfort is not left out. Heartburn, which is common with esophageal ulcer, then loss of appetite, because some people lose their appetite because when they eat, they feel pain. There's belching. Let us not forget that Helicobacter pylori also breeds, let's say, has gaseous exchange the way we also have gaseous exchange, and that is the repercussion. Then we have bloating. Remember that gas can give a sense of fullness as well. Vomiting and nausea is not left out. Vomiting of blood, weight loss, as in gastric ulcer, there is pain after eating, hence there's tendency to avoid food. Then we have weight gain, as in duodenal ulcer. Now, the food calms the pain down, hence there's tendency to eat more. We have melena, which is the dark, terribly smelly, tarry stool that people that have bleeding ulcers normally pass. And then insomnia, because pain at night disturbs sleep. Tell me, who can sleep with pain? So these are just some of them, and so on and so forth. So what are the causes and risk factors? Let's just take this carefully because we've done this before, but I hear a lot of people asking questions. Now, these factors that progressively damage the gastric mucosa and expose the stomach to damage from acids and enzymes during digestive processes are all termed causes and risk factors. Now, ladies and gentlemen, if you look at this image here, you can see this very ugly, or do I say very beautiful image here. But this beautiful image or ugly image has tentacles that you can use to attach to the walls of the gastrointestinal tract and cause terrible havoc. In fact, there are so many things that this bacteria has caused that people cannot imagine. Do you know that this bacteria can actually lead to heart problems? A lot of people do not even know that this same bacteria can lead to general joint pain and inflammation all over. In fact, systemic lupus erythematosus is postulated to get aggravated or provoked by this bacteria. It's a very terrible bacteria, and it is none other than Helicobacter pylori. A lot of people go for lab tests these days, and when they find this bacteria in there, they know that there's a problem, because this thing can stay with somebody for 15 years, drilling holes left, right, and center. But unfortunately, some people have their arteries opened or ruptured, and they begin to bleed, and they bleed until collapse, or they pass out, or they find themselves in the hospital. In fact, it's just like watching a horror movie or like Kanayo movie where they do use somebody to do rituals. The person is vomiting blood. There's no difference, because this bacteria can rupture a very important blood vessel, and the person starts to bleed, vomit blood, and all that, and pass out. And they say, oh, somebody in the village has shot an arrow to the person. My brothers and sisters in the Lord, it is no arrow, but Helicobacter pylori. Now, before we move on, I had a patient that had spondylosis and architective occur, and after he got better, he disappeared and went to the village for a burial. When he came back, I was like, where did you go to? And he said he went for a burial and his uncle died. And I asked what happened. He said the man went to ease himself in the bathroom and fell down there. But before they got to the hospital, his lips had turned blue, and it seemed as if the blood in his body was drained. And some people were beginning to suspect that it was what? An arrow. And I asked a simple question: did he have ulcer? And he said yes. You and I know definitely that most likely that was what killed him. So this is a major cause of peptic ulcer disease, accounting for over about 90% of peptic ulcer cases. Now, elimination of this bacteria is very important into the peritoneal cavity. What do you think will happen? It can get infected, septicemia, and anything can happen from there. Now, a lot of patients complain that they are having this sense of bloating and all that. That is because Helicobacter pylori has caused a checkpoint here. You know how checkpoint is on Lagos Onitsha Express Road, and you know how it's very difficult for people to pass sometimes. You see a lot of traffic jam because either some law enforcement agents have actually blocked the roads, coupled with the bad roads and all that. And you can see that this outlet here has been blocked. So what do you think will happen? Distension of the stomach. In 2022, I had a patient that called me after listening to one of my seminars online and said that she was having stomach bloating and some other symptoms like that. And by the time she finished talking, I said, have you checked for ulcer? She said she hasn't because her mind didn't go there. She didn't even really know what was happening to her. And then she ran to the nearest lab in Aja and she had an ulcer H Pylori Pro Max. You know, with the way we have Apple, something Pro Max. This was now Pro Max plus, plus, plus. It had blocked the outlet from which food goes. So anything she eats, she throws up. And stomach began to get bigger. And this is what we are seeing here. Then penetration is when, after it has perforated the stomach and is already spilling contents into the peritoneal cavity, it now crosses over to the neighbor. And guess what the neighbor is? The liver. It can cross into the liver or any organ around the stomach. And that's why you find that some people begin to tell you that their ulcer is now beginning to graduate from junior secondary school to senior secondary school, where the thing is now crossing from the left side and it's as if the pain is now radiating towards the right. So that there's a problem, my brother, and the Lord seek help. But the worst of all is cancer. I have how many patients now? We lost a patient and last year, the young man cried for his life, but unfortunately, because the H. pylori had already caused cancer of the stomach, it blocked the entry of food into his stomach, and eventually, the surgery that was fixed on Monday, there was strike on that Monday, and by Tuesday, patient died. It was so terrible when I heard about the news, and that's what H. pylori can do. Another patient had H. pylori and it had already caused some tumor different places, but H. pylori had gone, then we now started on that journey to take care of the tumor. You understand? So be careful, because a lot of people do not know that H. pylori can cause tumor or cancer or growth. Sometimes some people find it difficult to speak. They're wondering, what kind of devilish disease is this? You just take their voice. You know, it also has a tendency to cause lesions in the upper gastrointestinal area, like up there. So please, let's take note that H. pylori can provoke cancer. So when you are treating H. pylori, I don't think you're just treating it when you are busy drinking all these herbal concoctions and all that. Remember that it can cause what? Tumor. So what's the diagnosis? How do we diagnose this? Of course, endoscopy. As you can see, this is an endoscope, and you can see its light and everything over there. Antibody test is the one that is very common. I think it's about 3-5 or something these days and all that. That one is actually very good because you can actually have a result immediately. Then we have stool antigen tests, evidence of presence of, Helicobacter pylori. We have biopsy, urea breath test, and so on and so forth. So if peptic ulcer disease was responsible for up to 5,846 deaths, my brother and sister in the Lord, these were human beings. So let's be very careful. So that the challenges in the management of Helicobacter pylori. Looking at this picture already, or this image, you can see one of the greatest challenges. It is no longer afraid of what? Medication. Now, this is an antibiotic that has been sent to destroy this Helicobacter pylori bacteria, but you can see it is holding its fork and knife and is ready to what? Have its snacks. Now, the antibiotics are now like snacks for this bacteria because of a lot of factors we're going to discuss shortly. Drug resistance is a very, very, very terrible problem. This is when antibiotics that could previously kill H. pylori bacterium are no longer effective. This often as a result of wrong use of medication, underuse of antibiotic, drug resistance. That means the drug itself is actually, it cannot kill the parasite anymore because the parasite has now devised a system against it. And one of the reasons why this happens is because of wrong use of medication. People just take all sorts of things. What are you taking for your ulcer? Cimetidine and what's it called? And the one in the liquid bottle, Gaviscon. I'm like, who is giving you this combination? Another will say omeprazole and augmentin. I'm like, what's happening here? That is incomplete. We're talking about something that needs quadruple eradication therapy. Quadruple eradication therapy that was effective before is even becoming less effective. And then in order to help the bacteria better, you now decided to even add more problem to the matter by taking less than quadruple eradication therapy that is not even effective in most cases. That means you're making the bacteria stronger and stronger and stronger. That's one of the problems we're having today. We'll talk about that shortly. Self-medication, sabinus. Somebody's having ulcer. Hey, your neighbor say, hey, there's one baba down the street. He gave me one concussion. He did this, did that, did that. He danced at the logo around the concussion and the ulcer went. These are all fairy tales. They are lies. Helicobacter pylori is a very, very rugged bacteria. And if, in fact, that thing will take people, which normally take for 2 weeks, is mostly not even working anymore. You can ask, I'm telling you that even health practitioners are confused about H pylori. We'll see that shortly. Then there's poor awareness. Some people even believe that the Helicobacter pylori is a projection from the spiritual realm. Who said that? I don't think so. Ulcer is caused by Helicobacter pylori when people imbibe the bacteria one way or the other. We just talked about kissing. I showed us what Google said about kissing. So you can see that. Economic issues. That's self-explanatory because these medications are getting more and more expensive. Then we have depression and suicidal tendency. The pain is not of this world. When it is serious with somebody, in fact, it is like somebody is having, what kind of pain would I use to describe this? If it's level 0 to 10, person having level 8 kind of pain. If 10 is the maximum kind of pain somebody can have on earth, it's a terrible pain. And that pain can lead to suicidal tendency. People even want to go mad. I have a patient that kept calling me that's around 2 a.m., 3 a.m. That is, if I can't sleep, you can't sleep kind of patient. Like seriously. So it's that bad. You must have to find a solution to that person's problem. If not, you won't sleep. Then we have mutation to more difficult strains by the bacterium called superbugs. These bacteria themselves, apart from the fact that we are giving them antibiotics to gym and get stronger, they themselves are also adapting and trying new ways they can reform themselves to be able to resist these antibiotics. Can you imagine? Bad lifestyle choices. Remember, they say fool at 40 is a fool forever. Not that it's an insult. It means that changing habits can be very difficult. Imagine somebody that has been smoking for the last 20 years and the person now has H pylori and they now say you have to drop the cigarette. Sometimes some people will just say, drop the cigarette drop the cigarette and survive or continue and be killed by H pylori. Some people may even choose to say something must kill a man and they continue smoking because of what? Bad lifestyle choices. The other health challenges, we talked about arthritis, that's osteoarthritis and all the spondylosis and all the issues they cause like sciatica and all the knee, osteoarthritis of the knee and all that can lead to what? NSAID or analgesic consumption that can lead to Helicobacter pylori. That's why you find out that a lot of women that have menopause, just check this link out. When women get to that menopausal stage, estrogen drops, and estrogen protects blood vessels in women. Remember that blood vessels are around that area that Helicobacter pylori attacks. So you can imagine that the blood vessels are now getting bad, or their connection is getting weak, or they're having issues, in short. And then you now add the fact that estrogen also is osteoprotective, that's bone protective and joint protective in women, and that one begins to drop as well. So you now see that this back pain, neck pain, leg pain, hip pain, knee pain, ankle pain, and what they do is start swallowing analgesics. And guess what comes next? Peptic ulcer disease. This is often the case. And all that. So, of course, ulcer size and location. Some people have very terrible ulcers. Some people have been living with ulcer for the past 6 years and they have been very peaceful. The ulcer has been a very good neighbor. In fact, the ulcer can wake up in the morning and say, please, can I have some sugar? The person will give the ulcer sugar, they exchange gifts, like, and all that. But you can see that some people are very unfortunate. They can have ulcer in 1 month. It has almost killed them. So it's just like living with a snake. You don't know when it's going to bite. That's what it is. So it's better it's not there. That's why it's important to discuss about the treatment. I want to ask us a question. Can ulcer be treated or not? Is it treatable? Because people are saying now that ulcer is not treatable. Even some health practitioners are saying it's not treatable. But we'll find out whether that is true. So I asked Google again, is H pylori becoming resistant? And it says yes. Look at the top left corner here. Helicobacter pylori is becoming resistant to antibiotics, and this is a major cause of what? Treatment failure. A lot of cases of treatment failure. In fact, if I show you my phone and H pylori positive, before this meeting, people have been sending message, I've gone to do tests, H pylori positive. What do we do? Positive. Mother and daughter went to do tests. Was it yesterday or so? Positive. So what are we talking about here? So Google has said that. Now, the prevalence of antibiotic resistance to H. pylori varies by country over time, and so on and so forth. That's Google trying to explain to us that H. pylori is really becoming resistant. So those of us that keep doing what I call Ogbanje treatment, Ogbanje means go and come and go and come. You go to the hospital, they give you quadruple ejection therapy, they give you tinidazole, they give you, or maybe they give you cimetidine, they give you some other things. You go, you feel a little better. After some time, you are back again. They give you some same medication, you go again. After some time, you are back again. Now, it's just like management madness, doing the same thing over and over again, expecting a different result. Think out of the box. Ask yourself, why is it coming back? I always ask this patient something. Did you run a test to confirm that this H. pylori has become negative? And many of them will say no. But you could run a test to find out if it was positive, but you couldn't run a test to find out if it was negative. I'm going to show us something very soon. So is H. pylori treatable? Due to the challenges a lot of people face when battling this health condition, they ask this question. In fact, some patients, when they come to me and they ask me this question, they have this very sad face. They say, Dr. Drugs, please just tell me, is this bacteria treatable? Is it that this bacteria, is it going to kill me, or am I going to kill the bacteria? It has been here for like 10 years. What do I do? Another. And you see, talk about that very shortly. Wonderful. Google doesn't even waste time. It says, yes, peptic ulcer disease caused by H. pylori is treatable. Treatment usually involves antibiotics and a proton pump inhibitor. They did not say that is all, though. They said it involves, that is part of it. I'll show us what we're talking about shortly. Antibiotic, proton pump inhibitors are the things that help to prevent excessive secretion of acid in the stomach. Then we have antacids that directly neutralize acid. For those of us that were good in chemistry, you know what they call a neutralization reaction, where you use acid to neutralize a base, or a base to neutralize an acid, and all that. So you can see. Now, this is just an evidence. And it says that this person here is now H. pylori negative. Let's look at the dates. You can see here 30/12/24. And you can see that the person that had the results, due to patient confidentiality, the names have been blocked, has had ulcer for 10 years. The woman dropped a testimony. She sent me a message. In fact, she was so happy. Not only did the ulcer affect her, it began to take her voice away. So you can imagine that she used her voice now to give a testimony. In fact, she was scheduled for surgery in Kano. You understand? Oh, that's it over there. You can see that the result is even showing it. That's it. Look at it. Kano. She was scheduled for surgery in Kano. And guess what? Her voice has begun to come back. I don't think she's going for that surgery anymore. H. pylori is a terrible disease. But you can see that this is what your result should look like. H. pylori negative. This is another result, though it looks a bit shabby, but this patient sent this result to me and was also very happy that he had H. pylori negative. And this is another result you can see here. There are so many, but I just selected a few. Where is it? Oh, yes, you can see there. Where is it? H. pylori negative. This is what your result should read. Let's look at the dates. Let's look at the date of this one. This is 14. This is very recent. This is a very recent one. 14th of February 2025. What's today? Today is the 16th. That's just 2 days ago. So you can see that people telling you that H. pylori is not treatable, they are not telling you the complete truth. Or are they? So let me just even ask the question. Is H. pylori treatable? So type your answer. Let me see what you have to say. But so far, based on what I've shown you what Google said. I've shown you what my patient's results are saying, just a few of them. So what do you think? Is H. pylori treatable or not? The patient I just showed you last had H. pylori for 9 years. 9. In fact, when she got the results 2 days ago, she said she was rolling on the floor and thanking God because she has not had H. pylori negative. 9 years. Beautiful chemical intervention. These are designed to kill parasites and make its habitat or dwelling place in the stomach inhabitable. That means it makes it difficult for them to succeed. And they include a proton pump inhibitor or proton pump inhibitors, antibacterial, antiprotozoa, because H. pylori has this very weird way of acting like a bacteria and a protozoa. And of course, antacid to help with the neutralization reaction we talked about. And the above is called quadruple eradication therapy. Now, unfortunately, it is often ineffective as H. pylori is getting more resistant to it. Hence, after treatment, there is often recurrence of this terrible disease condition. In fact, in most cases, it never left. And that's why we strongly recommend or advise to use appropriate natural pharmaceuticals concomitantly. Now, a lot of people will say that or let me just put it this way. This is not what I am saying you should use for yourself, but this is just an ideal treatment regimen for Helicobacter pylori. As you can see here, I've used this and it has been very effective. But of course, treatment varies from patient to patient. No two patients are the same. But this is just an example of what a standard regimen looks like. And of course, you can see that this will definitely be expensive. And that's why we see there are also economic challenges. Because imagine somebody buying all these things, and you can imagine how much it will cost. But it's now left for one to decide what matters most to you, keeping your money in your pocket or allow H. pylori to dance a willow in your stomach. Now, what are the importance of natural pharmaceuticals in prevention of and management of peptic ulcer disease? You see, the reason why I talk about natural pharmaceuticals is just like I'm saying, let's think out of the box. We've been using these proton pump inhibitors, we've been using these antibiotics, we've been using these anti-protozoa, we've been using this antacid, and it has not been working, and you are still using it. That doesn't make any sense. So we need to think out of the box and tell us why. Now, they help to kill microorganisms that cause peptic ulcer disease. They boost the immune system against H. pylori. They weaken and destroy resistant strains of H. pylori. They seal up craters and sores in the mucosa where bacteria can anchor or come back. You can imagine after killing H. pylori in somebody's stomach, and then the holes and the craters are still there, and a homeless H. pylori that is just strolling on the street, like somebody strolling on the street of Lekki, and just finds a free accommodation. What do you think will happen? It goes there and continues from where the disease stopped. And that is why people have this H. pylori over and over and over again. Then they help to neutralize free radicals or radioactive oxidative species that damage DNA essential for production of protective biomolecules in the lining. Remember what I said about diabetes, which is a disease of diseases. Counters gastric hyperacidity associated with peptic ulcer disease. Talk about that shortly. And helps to prevent the recurrence of peptic ulcer disease and prevent inflammation, prevent damage, further damage, and promotes healing of the gastric mucosa, the stomach lining, and so on and so forth. Now, what I want to show us shortly, I'm not saying that you must use what I'm showing you, but this is what I use for my patient and it works perfectly for me. And please don't use these things on your own. Make sure you use them under the guidance of a trained health practitioner, because no two people are the same. Imagine somebody saying that he's having fever and headache, and because your neighbor has fever and headache and they gave your neighbor a drug called XYZ cetamol, and you just go and photocopy the prescription and you go and buy it. Don't know whether your own headache and fever can be as a result of early pregnancy, for instance. And you go and drink it and what happens. Because most people are the same. You must have to consult with the trained practitioner before you take any decision. So let me just give us some examples. Focus on the active ingredients. If you can find the active ingredients anywhere, please enjoy yourself. But this is what I give to my patients, and I have amazing results. Now, this is bee propolis. It has antibacterial, antifungal, and antiviral effects. Now, this is aloe vera gel, has been used for thousands of years. It has glucosamine, which enhances mucosal lining regeneration. It has asemaman, which produces white blood cells that fight bacteria. Remember, H. pylori is a bacteria. It has anthraquinones, which help with pain relief. Remember that it is even pain relief that makes people even drink analgesics that cause ulcer in the first place. And now, will you take more pain relief to cure the pain caused by the ulcer again? Definitely not. And that's why you see that some people are stuck between the devil and the deep blue sea. And of course, it also helps to cover those holes that are produced by this terrible bacteria. And that's why you see it's very, very important. Of course, it has anti-inflammatory and antibacterial properties and so on and so forth. It's a very popular product. We can't finish talking about this product today. So don't worry. You can meet whomever invited you and tell you more about this. The story never ends with this product. It's just amazing. There's so many things we can talk about. You can talk about it for a whole day. Now, Immune Blend, from the name Immune Blend, you know that it boosts immunity. Basically, it has mytake and shiitake and all that helps with immune support. It has anti-inflammatory effect, antibacterial properties, of course, antioxidant properties. And you know that Helicobacter pylori is bad bacteria, and the white blood cells can support in its elimination. This product has a very unique quality, and that is that it leads to DNA stability, first of all. And of course, it can reduce inflammation and oxidative stress and a lot of other things. Of course, you can see that the eicosapentaenoic acid and docosahexaenoic acid, as aforementioned in other videos by Dr. Drugs, you know that these have anti-inflammatory effects. Basically, they are indicated to help. Apart from the fact that they help to boost brain function, because we all know that these essential fatty acids, omega-3 fatty acids, are essential for boosting brain function. But that's just on the side. But it's also very amazing because of its anti-inflammatory effect. Imagine that we are watching football and we have 50 Arsenal fans in the room, and we have only 2 Man U fans. When Man U scores a goal and they shut off, definitely there will be 2 people shouting the whole hall, and every person just like. But when Arsenal scores, you see that the whole building begins to vibrate. We have more people. That is what we aim at achieving when we introduce good bacteria. Ladies and gentlemen, this is Active Pro B. It contains good bacteria, example like Bifidobacterium and Lactobacillus species, to drown out or suffocate the bad bacteria in Helicobacter pylori. Apart from the fact that they secrete acetic and propionic and lactic acid to help to destroy this bacteria, in fact, we can't even finish talking about what these probiotics do. Remember, it's a gut-brain and help to improve brain function. So have the ability to improve immunity, because there's also a very strong link between immunity and the bacteria in the gut. So you can see that by increasing the population of good bacteria, you suppress the population of bad bacteria like Helicobacter pylori. That's why this is inevitable. Remember, we talked about neutralizing the acid in the stomach. This has a buffer, fields of greens, and guess what? Because of the bleeding that occurs as a result of this Helicobacter pylori drilling holes in the gastric mucosa, you can find out, you see that the vitamin K that is found here can help to prevent that. In fact, when patients have issues like menorrhagia, that's excessive bleeding during menses, you find out that this vitamin K that hinders bleeding, excessive bleeding, is also indicated in that as well. So anything that has to do with excessive bleeding is, but guess what? The analogs of this vitamin K, the vitamin K2, are not left out when we're talking about issues that have to do with bone weakness, because they help to translocate calcium from the soft tissue all over the body back to the bones. Of course, we'll talk about that when we're going to be talking about osteoclast and osteoblasts and how they help to control bone density and the amount of calcium in the blood and all that. So we'll talk about that in some other video. But let's not also forget that it contains manganese and chromium. Chromium is a very, very important element with regards to insulin function. Chromium helps to boost or promote insulin function. That's why you can see that people are using chromium picolinate these days in cases of what? Diabetes. So this drug it's a multifaceted function. That means it has many ways it is very useful against H. pylori and peptic ulcer disease. Remember that diabetes can worsen Helicobacter pylori population and also worsen peptic ulcer disease. There are a lot of ways that we don't talk about now, maybe some other time. So P-Polin is amazing in the sense that it has anti-inflammatory effects and more. But before we go, I want to leave us with this. You are what you consume, and there is constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the winning side. That's by Prince Orago. And then let us kindly remember that we do not adjust medication and dosage without the guidance of a trained health practitioner. You can see this man on this picture here. He's not joking. And please, let's not make him get upset. And prevention is better than early detection. Don't say because it's Valentine's Day and you know that your babe or your spouse has PETIC ulcer disease and you go and have some entanglement, especially buccal entanglement, and then you begin to wonder why you're having a Helicobacter pylori. Please do not wonder, you went to receive the bacteria. So prevention is better than what? Early detection. And the choices you make today determine how healthy you will be tomorrow. That's a young man in front of 3 doors. The first door is saying, avoid this babe. The second door is saying, just buy her a flower and go. The third door is saying, just give her a lovely kiss, even though you know she has Helicobacter pylori. You and I know what's going to happen if he chooses the third door. Let's not forget that aging is not a disease and only requires maintenance. Thank you all for coming and remain blessed.